Today we're going to talk about a lower body lift, and there are many different terms that people use when they talk about a lower body lift. So sometimes patients, even plastic surgeons, use the terms circumferential abdominoplasty, belt lipectomy, and lower body lift synonymously, as if they are the same surgery. In reality, they are not. They all have a 360-degree incision that goes from your front all the way towards your back. And through the incision, different people do different amount of work. So when you have a circumferential abdominoplasty, you're getting an abdominoplasty in the front, you're getting your waist skin taken from your sides, and then you get a buttock lift or lower back skin removal and buttock lift. That's it. The incision is 360 degrees, but you get 3 procedures that is performed through that incision. The belt lipectomy means just removal of fat and skin. The belt lipectomy is, again, a 360-degree incision, like a belt-like, that removes the hip roll, the lower back skin, and performs an abdominoplasty in the front. So the belt lipectomy is, again, very similar to a circumferential abdominoplasty. And it's a better term to use than circumferential abdominoplasty because it indicates that you're having a tummy tuck, waist reduction, and a buttock lift. Now, in our practice, a lower body lift is far more comprehensive. It's correction of the front and back at the same time. It's correction of your tummy, pubic area, your thighs, the front of the thighs, the outer thighs, the buttock region, the waist region, the lower back region. So it's a far more comprehensive. Yes, the incision is exactly the same, but the work that is being done through the incision is different. So starting in the back, where the procedure is normally started at, we typically remove the lower back skin excess and the upper buttock skin excess. We preserve the fat underneath the skin, and we use that fat pad, the excess fat, which is also known as a hip roll fat, to augment the upper part of the buttocks with it. So that's called a flap. A flap is any tissue in plastic surgery that comes with its own blood supply. Therefore, it's a viable tissue, and it's going to be a viable tissue after surgery because it comes with its own blood supply. So we shape the lower back excess fat into 2 flaps, one for each side, and we place one into each buttock over the muscle. So now you're getting buttock augmentation with your own tissue, with the excess lower back tissue. That is called autologous augmentation. Autologous means from self to self. Once that happens, we get a buttock augmentation of the upper portion or upper half of the buttocks. And then typically I do liposuction and liposculpt my body lift patients, and I utilize that excess tissue and transfer that fat into the lower buttocks. That's called a graft. A graft is a tissue that comes without its own blood supply. So it relies on the surrounding environment, surrounding cells, to obtain nutrients and oxygens and to survive. Therefore, a flap is a permanent correction. A graft oftentimes is not. You get a partial correction. And that partial correction has to do with the fact that some of the fat cells resorb immediately after the transfer due to trauma, due to lack of getting oxygen and nutrients. And within the first 3 weeks, you will lose some of that. But once it stabilizes around the 3rd month, whatever you have is permanent. So those cells become a permanent correction. So that's where I start my lower body lifts typically.